Mental health experts continue to criticize why counselors were not at a shooting on I-65 last week. Metro Police started a program last summer where officers drive with mental health counselors. Today, police officials and 911 dispatchers admit a counselor could have changed the outcome that led to Landon Eastep's death. News 4's Marissa Sulik heard from mental health advocates today. And Marissa, I'm going to pose that question to you. Why were no counselors available last week?
It's because they have only 6 mental health clinicians in the program, and 2 of those are part-time. It's small right now, only at the North and Hermitage precincts. Today, mental health advocates told me that needs to change.
No, don't do it, Landon. No. Back up a little bit. Back up a little bit. Landon. Don't do this, bro.
In this body cam video, a group of 9 police officers point their guns at Landon Eastep. Not seen here, a mental health expert.
This is what it looks like when you don't know how to deal with mental health issues. This is the result. This is what you get.
A criticism Eastep's widow notices as well.
You know, you have shields, you have tasers, you have rubber bullets or beanbags, whatever they are. You have dogs. And if you see somebody is struggling with their mental health, the first thing should do is you should not pull your gun on them.
Today, advocates admit a mental health expert needs to be at a scene like this.
It is the right resource at the right time. And certainly last week's tragic incident demonstrates the importance of this work.
Right now, a police officer and mental health counselor respond together to calls at 2 precincts. Even dispatchers at the 911 center know that needs to change.
I think in the last week or so, we've had an opportunity to even reflect on what other qualifying types of calls for service may be eligible, specific to the incident that occurred a week ago.
That's why advocates want to expand this to Metro Police precincts who don't have the program.
If we receive a request for backup from a neighboring incident or a neighboring agency requesting service, that we could seek a mental health co-response unit to respond to calls like this.
The numbers show it works. The past 7 months, mental health clinicians responded to 1,500 incidents. 800 of those were someone with a mental health crisis, and only a small fraction required officers to use force. They're calls officers like Gabriel Centino respond to.
Showing up with somebody also that's not in a police uniform does help. People have all types of different interactions with police officers. Sometimes the uniform can be disarming.
Now, Chief John Drake did announce after last week's shooting he plans to expand the Partners in Care program to Midtown and Central precincts. Marius.
A lot of people hoping for change. Marissa, thank you.